India is becoming increasingly expensive. Medical inflation in India is 15% every year. Compare this with a general rate of inflation, which is only 6%. What this means is that the cost of medical treatment is rising at a rate that is 2.5 times more than the rise in the price of vegetables, the price of milk, the price of rice and wheat, and even the price of soap and toothpaste. If you get a heart attack and land in a hospital, an angioplasty can cost several lakhs of rupees. A heart bypass surgery costs nothing less than 5 lakhs. 1 day stay in the ICU in a corporate style hospital can cost you as much as 1 lakh rupees. So how do you bring down the cost of medical treatment? The key is not to fall sick and land in a hospital. Prevention is better than cure. But again, prevention can get expensive too. You go to a hospital and ask for prevention. They ask you to take the master health checkup. You have to go to the hospital early in the morning without eating. Spend a whole day in the hospital. They run a battery of tests and investigations, scans and x-ray. At the end of the day, the doctor comes to you and says, your kidney is fine, your liver is fine, but your cholesterol is a bit high. God damn it. Just by looking at the patient, we can say the kidney is fine. Just by looking at the patient, we can say the liver is fine. This is what they teach you in medical college. Physical examination. And you look at a patient like this, you know his cholesterol is high. You don't need a battery of tests and investigations to prove this. Master health checkup is a costly Indian invention. And that is why in advanced healthcare systems of the world, like the United States, or Canada, or the UK, there's nothing like the master health checkup. What they do there is targeted screening. Because everything there is driven by evidence and research and science. So what is screening? Screening is testing a person for a disease for which he or she is at high risk. But if that person were to get the disease, there would be no overt signs or outward symptoms. For example, a 10-year-old child gets tested for anemia. A 30-year-old woman gets tested for cervical cancer. A 40-year-old man gets screened for colon cancer. So what's the evidence in India? Let's take a look. So what's the number one disease in India? The disease that affects the most number of people in this country. The disease that affects 59% of adolescent females, 31% of adolescent males, 67% of preschool children, 57% of women in the reproductive age group. The disease that affects nearly 40% of India's population is iron deficiency anemia, and that's the number one disease in India, and still most people don't know about it. So what's the number two disease in India? The disease that affects 25% of India's population, hypertension. What's the number three disease in India? The disease that affects 10% of India's population, diabetes. But the problem with diabetes and hypertension is that they lead to two big diseases, stroke and heart attacks. Stroke and heart attacks account for nearly 25% of deaths in India. So all these five diseases put together, anemia, hypertension, diabetes, heart attacks, and stroke, account for nearly 75% of disease burden in India. If you can figure out a way to prevent these five big diseases, you can bring down the disease burden in India by nearly 75%. So how do we do it is the question. Is there an easy and cost-effective way of preventing these five big diseases? The answer is not the master health checkup. The answer is the faster health checkup. Because we here at Glanis Hospital practice low cost, high impact medicine. Because our patients come from villages, they are poor and they can't afford costly treatment. So the faster health checkup here takes only 3 minutes to do and costs only 30 rupees. And let me show you how. This is our patient from a nearby village. ஐயா உங்க பேர் என்ன?
பேர் ஞானபிரகாஷ்ங்க.
சரிங்க, எதுக்காக வந்திருக்கீங்க?
நான் வெளியே மருத்துவமனைக்கு போனோம்னா அங்கே பல ஆயிரம் ரூபாய் செலவாகுது. அதே சமயத்தில் கிளானஸ் மருத்துவமனையில் எனக்கு 3 நிமிஷத்தில் மாஸ்டர் குறிச்ச ஹெல்த் செக்கப்புக்கு 30 ரூபா செலவில் செஞ்சுக்கிறாங்க. அதனால் அந்த 5 வைத்தியம் முறை பார்க்குறாங்க. அதில் தெரிஞ்சுக்கிற மாதிரி இருக்குது. அதுக்காக இங்கே வைத்தியம் பண்ணுறது.
பார்த்துலாமா? இப்போ
பார்த்துக்கலாம்.
The last but most important measure in the faster health checkup is the waist size. Now, why is the waist size so important? Because research has shown that the ideal waist size for men is less than 40 inches, and for women it is less than 35 inches. If it is more, that person is at higher risk for diabetes, for hypertension, for stroke and heart attacks, and 12 different types of cancer. We not only do this at our hospital, we also go out to the communities and the nearby villages and do the 3-minute faster health checkup for the people there. For Jnana Prakasham, the 3-minute 30 rupee faster health checkup was successfully completed, and all the tests have turned up normal. But if any of the tests had turned up abnormal, what would be the cost of medical treatment? At Glanis Hospital, whether it be anemia or diabetes or hypertension, the cost of medical treatment over a period of 3 months is only 300 rupees. How is this possible? It is made possible by this, the low-cost Jan Aushadhi pharmacy program at Glanis Hospital. Because we at Glanis Hospital believe in low-cost, high-impact medicine. In India, there are 5 big diseases that we are struggling to fight. But to top it all, there is a 6th big disease that is so widespread among the people. And we need to fight that too. And that is the fear of going to hospitals because of the high cost of treatment.